This is John Miner. I'm a non-operative sports medicine specialist with Spark here in Tucson, Arizona. Today I would like to just introduce you to ultrasound and the use of ultrasound in medical settings, particularly musculoskeletal and orthopedic clinics. In the past, we have had machines that were $100,000 machines that were big, bulky, and had to be rolled from room to room. But in this day and age, we actually have ultrasound machines that connect to tablets, and we can easily port them from room to room and easily evaluate for musculoskeletal injuries. In the setting of musculoskeletal ultrasound, we have two different ultrasound probes that we use. Here's our high-frequency linear probe that allows us to look at more superficial structures, things closer to the skin. With ultrasound technology, we can see tissue that is outside of the bones, as the bones and other really hard structures will actually create shadows and prevent us from seeing deeper structures. But typically, the high-frequency probe will allow us to see structures easily within 2 to 3 centimeters from the surface. As we get into deeper structures, lumbar spine, facet joints, hip joints, piriformis, various other structures, sometimes wanting to really examine more of the quad muscle, for example, we might use a low frequency curved probe, such as this one, that will give us better image quality of those deeper structures, particularly because of the array and scatter that the sound waves are being sent into the tissue. Ultrasound is a wonderful technology for us to use in the clinical setting. It is very user dependent. While this tablet and device may not be wonderful for somebody first learning to use ultrasound, for somebody with great experience, this can be used not only for diagnostic ultrasound, but also for ultrasound guided injections and procedures. These procedures can be done sterile with incredibly low risk of infection or other problems. And in the setting of performing injections, we can actually see the tissue that we are trying to inject and watch the needle travel through the tissue in plane or out of plane, sometimes seeing the dot show up on the screen, but making sure that we're targeting the correct area with ultrasound guided procedures. When we are performing procedures and injections, there are various different components or composites that we can inject, such as cortisone being the most common. Cortisone is a wonderful anti-inflammatory, but comes with potential side effects, other risks, and for that reason we don't want to perform repeatedly in any calendar year. Other solutions that we will inject include things like platelet-rich plasma or PRP. I've had success also using autologous blood patch, where I will draw blood out of my patient and then inject that back into an area where an injury is present or where I have recreated an injury with a needle tenotomy procedure, just passing that needle through an area of injury. Platelet-rich plasma is where we actually draw the blood from the patient and we spin it in a centrifuge that layers out the blood components so that we can draw off the layer of the platelets that have healing growth factors contained in the platelets, and then can inject that in a slightly concentrated form back into the body to promote healing and tissue repair. Sometimes we also do trigger point injections or prolotherapy, which in my case I use hyperosmolar dextrose solution and will inject that into various appropriate parts of the body to help promote tissue healing and tissue remodeling. In addition to performing injections to get patients better, and the injections themselves also have a diagnostic component where I have injected oftentimes an anesthetic agent, for example with my cortisone solution, and I can examine my patient before and then see that I've made a significant difference after the injection with various provoking tests after the injection to make sure that I've addressed the problem, and that will also help give us a more formal diagnosis as well. Many times in the hip in particular, it can be a tough joint to diagnose the underlying condition, because there's so many problems that can be going on with various referral pain patterns. So many times an ultrasound guided injection can actually help confirm what's causing the pain. The oftentimes hip flexor psoas tendinitis or bursitis versus people who've been told they have a labrum tear on MRI. Finally, one other diagnostic purpose of ultrasound is literally being able to dynamically watch a joint move, stress a ligament, watch a tendon move, and look for pathologic changes, swelling around a tendon, bone callus forming at the site of a stress fracture, actually seeing the cortical defect at the site of a fracture as well. Ultrasound is wonderful technology and is becoming more and more common in these days, and we have available right here at Spark as well.